Hi friends, this is Laura with Potpourri of Life. I want to talk to you about something that not many people are talking about, or maybe it's starting to come out. What I want to talk to you about is this. No, it's not junk mail, or is it? This is just a few weeks worth of Medicare Advantage type advertising. Now, why am I bringing it up? Nah, I'm not eligible for that. I'm 62, but my husband will be 65 in a few months. We have been getting mail since September or October, like 6 months prior to him turning 65. What I want to share with you is some facts and some information that I have been learning. And I've been wanting to share this for quite some time. I started a video and then I stopped and I'm like, but it's out there. Now, what you're going to be offered when you get to be 65 is you get to choose between the regular Medicare or the Medicare Advantage. Now, one thing they don't tell you is the Medicare is free. It pays for your hospital care. It doesn't pay for doctors. It doesn't pay for clinical visits or anything like that. But that's there for our hospital needs and stuff. That's kind of cool. That's free. That's what we paid for during our whole work life. But what happens is then you end up with a Medicare B for your doctors and clinicians and stuff. And if I recall correctly, it's like $125, $150 a month per person. Okay? We haven't even gotten to dental and the other ancillary programs. Now, to me, that just seems kind of high, but, we have to kind of weigh the risks and stuff. And as you might get a raise with your Social Security check, guess what else goes up? Your Medicare Part A, not Part A, but Part B, and then all your ancillaries, they end up going up. And this year, from what I read, the ancillaries are going up, Part B and stuff. And I looked at it and I'm thinking, we can't get out of this. So my husband's in the position of he has to choose if he's going to go on Medicare or if he wants to do Medicare Advantage. I want to talk to you about Medicare Advantage. I have been reading up on this for about 2 or 3 months because his junk mail comes in. We've been working on the estate, as you know, and I started getting this and I said, David, you do not want to do this because the flyers are very convincing. I haven't opened these. I've opened a bunch of them, and we just throw them away. We rip them up and throw them away if it's just Medicare Advantage. And we will not go with any agent that's what they're promoting. And I'll tell you why. First of all, Medicare Advantage is far cheaper. It truly is. If you're on a budget, that's the selling point of Medicare Advantage. It's cheap. Your monthly premiums are nothing. Sometimes it's zero, sometimes it's a few dollars, but it's far less costly than Medicare B, because A is supposed to be free. For how long, I don't know. And maybe I'm wrong, but that's what I understand. Okay, so we're on a strict budget. Can we afford Medicare B if David wasn't working? Probably not. But where I am going is you're going to get sold Medicare Advantage. And I talked to a few of older people who are on Medicare Advantage, and some of them are really happy with it. And one person I spoke to, she says, but Laura, this is so much more affordable, and we have our providers all in network and stuff. Just like your regular insurance. I won't say what company we have, but you have to be aware of what your insurance company covers. You need to know what providers they cover. You need to know, do they cover lab work? I know our insurance, depending on which doctor orders it, if they order lab work, we have to go to a lab site. The cost is no different whether I go through my physician, who they do cover that one, or if I go through another doctor and have me go there, the price is the same. Now, in terms of, and I'm talking regular insurance, your big names that you get from your employer, you have to check to say, okay, this year, are they going to still cover annual exams? They'll always cover annual exams, but you never know. You might have to start paying a copay. And that's the other thing. You need to know what is covered, what kind of copays you have. For us, my copays to a regular physician, for an annual exam or a flu shot or whatever it is that you want to go see your regular physician for, that's $20 visit. If I go to a specialist, which right now what I have are 2 specialists, I pay $35 for every visit. Now they can do some things in that visit, and then other times I can go to that same clinic and then go and have a procedure done. Now, I just had a couple of procedures done, and those I had to, that was a nightmare. I had to find out what the codes were, and the financial department and the insurance company refused to give it to me. They said they don't know. So I had to go to my doctor. He gave me one, and then he didn't know what the other code was because he does one and the other test was from another department. So I understood that. I didn't understand that I'd be going to 2 different departments, but that's when I realized why we didn't know what it was. So I finally went to the financial department and I said, listen, I'm not coming in for these procedures. My doctor highly recommends them, but I need to know what is my responsibility. So finally I get the information. Okay, I know what my deductible is. I know what I have to pay. And these 2 procedures, I know what my cost is. So what we have to do, because we can take some flexible spending money, we can plan for something like that. And so that's what we did. Now, my doctor had thought that maybe having it done like in December would be the best for me. But we hadn't even reached our deductible. We didn't have extra funds taken out. And I knew that it was going to be costly. So I was like, no, I'm going to wait until January. And so we did. We waited. We got it done this week. It's all done. But I had to do a lot of legwork to find out, are they covered? How much is my responsibility going to be, etc. Got the information. We did what we needed to do. It comes out of David's check pre-tax. So I want you to be aware that you need to know when you have your new insurance companies prior to starting, what is your deductibles? What are your copays? Know all of those facts. But the same thing happens with Medicare Advantage and all these other plans. We think that when we get older, we're going to get on Medicare. It's not going to be too much. We're living in a world of unicorns because we're not thinking forward. But if you talk to your parents or grandparents, you might learn something new. So I know that the insurance company that my mother-in-law had when she had cancer and stuff, they covered everything with her cancer and stuff. And so my father-in-law was really blessed because he didn't get a bill at all. And even when he recently passed, we didn't end up getting any bills, but he was paying his insurances and stuff. But why I'm bringing up Medicare Advantage is because my husband is eligible to sign up. You have to sign up between 3 months before and 3 months after to decide. You have to sign up. You don't have to take it. You have to sign up, or you get penalized when you lose your job or you decide to retire. You get a penalty. Now, I think that's selfish. I think it's greed on the government side. I think it's horrible. That aside, because if you're already paying for an insurance, why should you have to take on another one? Why should you have to pay for Part B? Why should you have to do that? I think it's wrong. So, I'm not going to tell you what my husband's decision is because he hasn't decided that. He still has a few months. We're still a few months ahead, and we still will have the 3 months after. What I want to talk to you about is Medicare, the regular one, with Part B and all these other. Yes, it will be more expensive than Medicare Advantage. Just because it says Medicare on the Advantage, trust me, be very careful, do your research, and look for an agent who doesn't only promote the Advantage. Number one, those who promote the Advantage plan, you have to understand, they are agents, they are doing a job, so they will get paid. They get paid 3 times as much for the Advantage plan than they do the regular Medicare plan. So if they get paid $200 for the Medicare plan, they're going to get paid $600. Rounding about here, folks. $600. So what's their motive? What's their incentive to sell you a plan? They're incentivized to sell you Medicare Advantage. So if you go to see an agent, be aware of those facts, number one, because they need, their job as an agent is to share the pros and cons of this one, the pros and cons of that one, give you a dollar amount of what you're going to be expending. All right. So some people think, and this is fine, I just go see the doctor, all this. But just like your regular insurance, you need to understand that not all doctors are in network. Okay? The big places generally are. But here's something what happens with our regular insurance too is if there is a doctor that is like on call but not part of the system, or is an ancillary doctor where they come in and they work on their own, they're not part of the system, you won't get billed by that particular facility. And I'm talking like a big hospital setting which has clinics, the hospital and emergency room and all that. Some hospitals, everything, their anesthesia, everything is covered by your insurance because they're all in network. But sometimes you go to another hospital and you're in network, they might not be in network. That's just on regular insurance. It happens on Medicare as well. Medicare and Medicare Advantage. Medicare Advantage, the doctors can sign up to be in network. But the negative of that, they can bow out of that any time during that year. So you might think that your doctor is in network and you go to see them like 6 months later and you go in, then you get a bill because they're no longer in network. That's the Medicare Advantage, okay? That's going to hit you and it's like, that's a surprise bill. In some states, it is illegal to have surprise billing. They are supposed to let you, ethically, you should know ahead of time if your doctor is in network. But it doesn't seem like our world is full of ethics anymore, and it has nothing to do when the world crashed there a couple years ago. It has nothing to do with that. It has to do with the fact that we have people that are greedy and are looking for their purse, not yours. And in healthcare, we already spend way too much money. When they changed this, and I won't tell what president, but when things happened and we were going into a new healthcare, like we're going to have healthcare for everybody, I said to my husband, I said, you watch, our healthcare dollars are going to go up so fast, we won't be able to keep up. And that's exactly what happened. Within a year, they started going up, up, and up. And now we have insurance companies that you have a deductible, you have copays, and then you have out of pocket, and then you have out of network, and it's kind of crazy as far as I'm concerned. So with our insurance, we have a decent plan considering all the dynamics of what insurances are doing. But I have my copays. But with the testing I just did, I met my deductible. But there is a deductible for all out-of-pocket. There's an out-of-pocket total that I have to meet as long as I'm in network. Otherwise, it's more expensive. So I still have to pay my copays for my doctors. If he has a special test that is not a typical lab work, my lab is usually 100% covered, but there are special tests like CAT scans. That's $200. There's MRIs. I don't remember what that was. That's a price. If I go to the ER, it's $500 unless I get admitted, and then you have all those other wonderful costs. So even with this, you have to start asking, what does it cover? If you are covered under insurance right now at work, and you plan on retiring, and you plan on going on Medicaid and Medicare, whatever, Meta whatever, you need to start researching it, not 3 months before, not 3 months after you turn 65. You need to know what's going on. Your employer generally cannot help you here. Some of them might be able to give you some tips, but they generally cannot give you the information because it could be conflict of interest. And plus, they're not agents. But you get to choose. If you're not going to take these, you get to choose to defer it, or you can take it now. Again, I don't know what my husband's going to decide, because I think we're done with most of the estates, and then we just have to weekly check in and do some small stuff until a few other things happen. So I told my husband, I said, you need to work on this. And I think I'm going to wait till next week, because we have a few more things to get accomplished this week. But he knows, because I've been telling him this stuff. I said, it's crazy. So you need to know that Medicare Advantage should be renamed to Healthcare for an Advantage Healthcare Plan, or an healthcare option for retired folks. It's not, because it says Medicare, a lot of people are confused. They think it is also Medicare. It's not at all. Now, say you decide, you know what, I'm going to try the Medicare Advantage. You're going to ignore everybody's warnings, and that's okay. Because you know something? Some people have a bank full of money that they don't have a problem. They want that low premium, and so that when they have to go to the doctors, it's worth it to them to have the Medicare Advantage. So there is some pros and cons to it, but you have to understand what's the pro and con for you. My husband and I are not wealthy, but would we go with the Advantage plan because it's cheaper every month? Probably not. But, you know, we have to look at the dollars and cents and kind of weigh it out. I'm hoping by the time I reach 65, I know what I'm doing. I'm hoping they get rid of this Advantage plan. And I'm hoping that everybody that's on there and can't get out and want to, they can. But one thing you need to know is 1 year from the time you go on it, you have a whole year. Don't wait until the last day. You have a whole year, though, that you can say, you know what? This isn't working out for me. And you can revert back to the Medicare original plan. That's one thing I did learn. So if you want to go cheap for 9-10 months and you're not seeing the doctor much and everybody's in network and save money for that first year, you can do that. I'm kind of that person who's very frugal, but be very careful. You never know when another loophole will come up. It happens in our regular insurance. I used to get a particular procedure, and I had 2 physicians doing this procedure, but one used a medicine, another did another thing, and they were focused on 2 different areas of pain. There was never ever a limit until all of a sudden I get a letter in October saying you went over the limit, and I'm like, huh? They changed it a month earlier and said, but I said, why didn't you send me a notification? Because you see that I get these. The doctor should have known. The doctors didn't know because they never ran into this before. There was no limits before. So you always have to be aware of what's going on. If your doctor recommends a procedure, oftentimes many of them are pre-op. Not all of them. Like I had I can't even think today. I had to do a ultrasound. One of the tests was an ultrasound. You can get an ultrasound for a variety of things, so it protects my privacy here. But there's still a code, and you really want to find out, is that covered by your insurance? So it's covered by my insurance at a cost. And I have to pay that and that'll go towards my deductible. There is no copay for it. There is no minimum. I have to pay the difference between what the insurance will cover or what they approve, but I have to pay up to my deductible amount. I was so excited. The point is I did the research. You have to do the research, whether it's Medicare Advantage or the original Medicare. Now, I want to share something with you that I learned through a thing that I read. It's a page that I read. It's a bunch of medical stuff and everything. So I am going to go to this page and I'm going to share some things about Medicare Advantage. Well, Medicare Advantage plans took the top spot in this year's Shkreli Awards. This is an annual list from the Loan Institute that calls attention to some of healthcare's most greedy and unethical behavior. The plan's penchant for defrauding or overbilling Medicare by an estimated $25 billion in 2020 alone by saying beneficiaries were much sicker than they actually were when they earned these marks. Okay, so others who made the 2022 list, including Texas hospice leaders who tried to hasten patients' death to avoid losing federal funds, a Wisconsin dentist who broke patients' teeth so they would need crowns. This is awful. And a Virginia hospital that diverted federal discounts from its poorer hospitals to the wealthier ones. Okay. They talked about farmer executives who raised the price of life-saving drug for AIDS patients from $13.50 to $750 per pill. And this particular executive, he was in prison. He was sentenced to 7 years. Now, Medicare Advantage companies were selected as the worst offenders because the prevalence of fraud was so overwhelming. It struck a chord with our judges. It was pretty prevalent in that 9 of 10 insurers in terms of market share were among those named. So it's not just 1 or 2 bad actors. If anything, it is their business model, a pervasive and systemic problem with immense costs that, in my view, really represent foregone opportunities to make us all healthier. In a series of stories of downsides of Medicare Advantage plans focused on enrollees' problems getting access to specialists, deceptive and fraudulent Medicare Advantage plan marketing, and federal attempts to approve all TV ads that they can air. Come on, folks. This is awful. Stop watching the TV ads because it's just, remember, I told you before, advertising is meant to sell you something. The series also pointed to a federally approved commission structure that results in brokers receiving, I told you earlier, receiving 2 to 3 times as much in commission for selling Medicare Advantage plans than the Medicare supplement plans. Remember, the regular Medicare is free. It's the supplement plans that you might have to purchase, like the B plan, and that's for your clinics, and then you have a drug plan, you have a vision plan, you have a dental plan. You have to decide what's right for you. So they say the winners are most large Medicare Advantage insurers now face federal accusations that they have been defrauding the Medicare program by mining patients' charts for diagnoses, that have resolved or which have never had, or exaggerating their severity. This is why I really don't like other people having access to my medical records, and I'm having a hard time with it, and I'm trying to back out of the healthcare system because it's like, why should people have to know our personal information? And in this case, they're taking advantage of that information. The amount of overpayment is estimated at $25 billion in 2020 alone. And that was a New York Times investigation and numerous other investigations by the Office of Inspector General. Okay, the huge amount of overpayments has raised questions about continued federal payment policies to these companies and the health of Medicare trust funds. Now, let me see if I want to bring this one. There's some other things that are going on. That was the first one. They were the top. Okay. So Medicare Advantage is the worst offender. Do you want to have an insurance company that is defrauding Medicare, the government? I'm sure many people say I don't care. But I care. Because first of all, if they're defrauding and making things up just so they can get paid, based on maybe something that's in my medical history from 10, 20 years ago and bringing it forward, something that may have been resolved, or making things up, that is unethical and it needs to be shut down. Who am I to say all this? The thing is, this is what I'm reading. The thing that for David and I, as we get older, we want a plan that we can count on. We want it to be an ethical plan. Do I think insurance companies are ethical? No. Do I think Big Pharma is ethical? No. But, these are the systems that are in place right now. So you as a patient, or you as a senior citizen who is having to make this choice, you need to start looking at these options. Okay, so you might be asking me, well, what about the people that are already on Medicare Advantage? Talk to these agents, because you're going to find out if you've already been on the Medicare Advantage, you can never go back to the other one. And if after your year premium, if you are able, there will be a penalty added. I have a hard time with these penalties because you didn't sign up when you turn 65 and you're healthy enough, you plan on keep going. I just don't know it. I mean, when I started reading this and then I was listening to a specialist, I listened to like 3 or 4 Medicare and Medicare Advantage agents, and they specialize in helping people get Medicare and make them understand the pros and cons. And they do say a lot of people go to the Advantage because you know what? We're not going to have the money for the regular one. I don't know what we're going to do. Quite honestly, we are working so hard to stay off medications. We are working on it so hard. But fortunately, with our insurance, we have a copay, a small copay, depending on what kind of medication we get. The reason I enjoy working with herbs, first of all, they're very stress-free. I love the sense of herbs. I love how medicinal they are. They don't always resolve everything, but I'm learning. I did some studies today I did a study on antibiotic herbs today. And because I don't think people understand all the fillers that are in the antibiotics out there. And we have a lot of people getting, they can get antibiotic kits in the event that there's no antibiotics available, and they're doing it as a prepper and I think that's a great idea, honestly. I really do. I'm not knocking anybody because not everybody's going to have access to herbs. Not everybody's going to have the knowledge of how to use these herbs. And I mean, I have a ton of books and I'm reading, I'm trying to learn every single day. I take courses so that I can learn a little bit more. But that doesn't mean that I won't need a medication. The sad thing is, medication, many older people will not take them, or they'll cut them in half. There's a medication my doctor wants me on, and it was a compound. It's not covered by my insurance, whatever, but I was willing to pay it. First of all, it's supposedly safer, and I believe it is. But the customer service I got, it would take over a month for me to get my medication. And then if I called a month early, they say, oh, you can't get it yet. And I would have to argue and say, this isn't even going through the insurance company. And they still would not send my medicine, so I was always late. And so finally I said, forget it. I told my doctor, he goes, next appointment, we'll be talking on that. It's not that I don't believe in medicine. I actually believe in compound medicine, but you need to work with a pharmacy that is thinking of the patient. They can't wait forever for their medication. And now we have shortages of medications out there. Now, I am not going to fearmonger. These are some of the things I heard, and this is what I did when I first started hearing this, because every now and then I have to go on an antibiotic, and that's why I'm doing a study on herbal antibiotics. I talked to my physician. I said, this is what I'm hearing. I went to this website, and it shows all the medications that are in short supply. And this is what he said, and this is what you need to do to talk to your physicians. I said, I went to this site, and it shows all the medications that are in short supply. They're a hard time getting in, all this. I said, but there's others that you can't get. Can you tell me, in reference to my needs, when I need an antibiotic, do I need to get something ahead of time? And there was no question. He didn't stutter. He didn't hesitate. He said, the ones that you are on are first made here in the United States. And right now, he said, right now, we are not having a problem getting them in. You see, you can talk to your pharmacist as well, because when somebody hears that, oh, we're going to be short, they might put something out on YouTube and scare the crap out of everybody. Sorry, I probably shouldn't have used that term. They might scare you half to death. And I wasn't scared. It just kind of like, okay, what are they talking about? And then I went to a site and I said, oh, these are the ones. Those I don't have to worry about. But I like being proactive. And since I read a lot, I like to double check things with my physician. And I realize a lot of people do not believe or trust their doctors. My doctors are older. I love my older doctors. The younger doctors I had to let go, because I just saw them sending me to this test, sending me this test, and they were repetitive tests that I've done, or I would answer questions, those questions that you get. What's your pain level? How have you been feeling? All of those. And by the way, when you're on Medicare, you're going to get stuck with those answers because they have to ask you. I don't answer them. I just tell them I'm fine. Because what happened to me, and it was about, I think it was about 8 years ago. I got this young doc. He was new, and they did the questions and stuff like that. And then he came in, and he goes, I want to work with you. I said, but what? I said, my pain. He didn't believe in Lyme disease, or he believed in it, or that's what he told me. That's how he got me in there. I don't believe you have it. I said, oh, you don't? I said, even with all the documentation, even the stuff from the CDC, you tell me I don't have Lyme disease. Nobody can have it that long. I said, okay, gotcha. So that turned me off right then. I said, so what is it that you're going to help me with? He says, well, I think you need to come in and talk to me on a routine basis, and we need to get you on a medication. I said, what kind of medication? You got it. Antidepressants. And I said, why are you saying that? I said, first of all, anybody can be depressed because they're having a bad time or different things. And I said, think about it. I have chronic persistent Lyme and I'm still struggling with this. That'll take anybody down. He goes, well, I think you need to. I said, what's your grounds? He says, just because when you answer these questions, I said, those pain questions? He goes, yeah. I said, I'm done. I said, you can't base it on that. You asked, that question says, what's your pain like this week? What's your overall pain? So if I tell you my pain level today is an 8, I have a mental problem? He goes, well, you have a history. I said, okay, I'm done. I don't answer those anymore. Now, I'm not on a Medicare plan, but I do know that oftentimes they're asked these questions. I don't know if you can decline them or not. I don't know. But as I get older, I'm getting a little bit more stubborn, and I'm saying no. The other thing that you need to be aware of, whether it's your insurance or whether it's the Medicare Advantage or regular Medicare, You need to know what your costs are going to be. Now, one thing that some healthcare facilities do is they have you sign a waiver so that anything that your insurance company doesn't cover, you'll pay. Now, you might think that, okay, my copays and deductibles, I'll pay, right? It's more than that. If you are coded for something they didn't do, it takes months to clear up, number one. Number two, if the doctor deems, well, they need this, they need that, but you've signed that, they can charge you for these and it's not covered under your insurance. So I'm talking to just people with regular insurance as well as those with Medicare Advantage or anything else. Don't sign that. You can't be forced to sign something that doesn't make sense to you. But if you're okay with that, then you do what you got to do. Because if my physician decides that, Laura, I really need to do this test or I really need to do this procedure, but it's not covered typically by insurance, then you know what I do? I go to the insurance company and I ask, how much do you cover? If they say none, and I say, okay, I go to the financial department and say, how much is this going to cost me? If it's $25, I don't care, do it. But if it's $2,500, that's a different story because it won't be covered. And I have to somewhere dig a grave or whatever and find $2,500. My trees do not produce money, I promise you. I wish they did, but they don't. And so, as we all are having problems, or kind of like saying, going to the grocery store and like, the amount I put in our baskets is getting smaller and smaller. Pretty soon it's just going to be the gallon of milk and that's it. We need to be aware of those monies. Now, one of the worst places for debt is in medicine. People are huge in medical debt. Now, I suppose some of you will not have a problem being in debt if you're on Medicare and you're alone, you're single, whatever the case may be. I'm not promoting this kind of thing. And there's nobody else responsible for your debts after you die. But the last thing that I would even want is to have people after me. Most organizations will put a lien on your home if you don't pay your debt. Just putting it out there. If you have an apartment, they're just going to go after whatever asset you have. But most often, many of us have homes. They're going to go after that. They're going to just put a lien on it. So when the estate is being closed, that's being taken care of. And no, there was no lien on my father-in-law's house. But those are the things that you need to be aware of. But I'm mostly coming in here to talk to you about Medicare Advantage. Know your prices. Know how much you're going to be charged. Before you go to see that doctor that was on the plan, call your insurance company. Is she still in network? Find out. Because they can step back. Because, see, what happens is Medicaid and Medicare and all these, they don't reimburse as well as like our insurance reimburses. It's a small fraction. And so doctors are not being reimbursed so that they can afford to stay in business or make the money that they can make on other people with regular insurance. So doctors are getting tired. Now, do I think doctors should still do this care? I do. But I don't think one doctor alone should take it all. I think Medicare patients should be kind of spread out if possible. But still, I mean, what do you do if you're not working full time and you don't have a regular insurance and you go on Medicare and all of a sudden your doctor is not going to take you? One of the physicians my husband sees, he's not in the hospital setting. He has his own private practice. He doesn't take Medicare. So I don't know what my husband's going to do when he retires. Plus, some facilities that are part of the big bit, they're not taking new patients. I find it flabbergasting. I find it overwhelming to realize that there's not enough doctors. But they have nurse practitioners, they have physician's assistants who do the same stuff. But that doctor, he has to oversee them. So if they have a question, that doctor has to oversee making sure that things are done right. Yes, a nurse practitioner and a physician assistant makes really good money, but the doctor is still responsible for them. But they still go to a school, and I mean, the reason that they can't be a physician is they didn't do all the extra coursework and all the residencies and all those other things. Actually, I don't know for sure. I just know that they don't go to school for the same length of time as somebody with their medical license. I really want to bring attention to the Medicare Advantage, what I call fraud. That's my personal viewpoint, and maybe this video will get shut down, I don't know. But the place where I read this information, it's on MedPage. You can go to Times and search. You can look up the fraud of Medicare Advantage, the disadvantage. Just start Googling Medicare Advantage disadvantage, Medicare fraud, Medicare benefits, the pros and cons. Don't go to a place that sells it, because they're only going to tell you the advantages. And I hope that the more awareness comes through. When I read this the other day on the medical site that I go to, I was like, phew. It's not just this one person or these. I listened to like 3 people agents that sell this stuff, and they do their best to sell the less costly. There's no incentive for them to sell the regular Medicare plan. There's no incentive because they make 1/3 the amount. It's sort of like the doctors who decide they're not going to take Medicare patients because to them there's no incentive, because they don't make as much for their time. I think we need to waken up to what's going on in the medical arena. Now, I have a great deal of respect for my physicians. I don't see one who helped with my pain, because I'm kind of handling it on my own, and it's just the facility that I go to. It's just kind of like, how do I want to put this? I don't really want to put a negative twist on the physician because I love them, but it's just basic stuff, and I'm dealing with those pain issues he was helping me with on my own. And he did a lot of modalities, some natural options, but my insurance doesn't cover those kind of things. And my insurance pays for something that he does, but not in this facility. Go figure. But so I decided I'm not going to do that. I'm going to just do my herbs. I'm going to do some other things at home. And I think he'd be proud of me. I don't know. But I have another specialist. I cannot yet leave. First of all, I really like him. He's helped me a great deal on something. But he agrees with me in terms of it would be really nice if I no longer had to go there. Not because he wouldn't make money on me. Not because he wants to get rid of me. I think I'm a real good patient. I mean, some days I'm not so great. But for the most part, I think he wants to see me well. That's his goal. That's my goal. Sayonara. On a good note, there are some great doctors in the arena of medicine that are old school. Those are my kind of docs. I like functional medicine docs. I have one. I like holistic docs, which functional medicines are. Those who do massage. My massage therapist isn't a physician, but she specializes, and she's always updating her training and stuff. She's fabulous. Excuse me. Should have brought water, so the tickle is bothering me. Anyways, but she's phenomenal, and I was just thinking, I need to schedule an appointment with her. And I've been holding back because I'm trying to figure out different things, and I had to pay for this stuff. But I think we need to become more aware of how we can better protect ourselves from medical debt. You know, I'm all for getting whatever you need, But you also need to know what your responsibility is. There's another factor that you may not be aware of, and not all medical facilities will tell you this. There is financial aid available. Yes, you do have to qualify. And if you don't quite qualify, you can appeal. And what happens is they take, depending on how many people are applying, it could take a couple of months before you get the approval. So you don't have to worry about your bill until that comes through. Put money aside so you can pay it when it does. If you disagree with them, you can appeal it. So you're still okay. You're not going to be harassed when you go to the desk. It doesn't mean you're not going to have a responsibility. But what a lot of people do not know is that there is financial aid in many facilities, most especially your larger facilities. They won't tell you. Your doctor doesn't tell you because that's not his job. His job is to care for you. I had to research it, a few years back when we needed it. I couldn't get the care. I couldn't afford it. And so it's a lot of work if you have to appeal. They ask for a lot of personal information. But if you can't afford your health care, you need to seek financial assistance. And they have it. Seriously, people will not tell you. And I think that's a disadvantage. But then again, how does a physician tell you to go that route when he doesn't know how things are for you and your family? So you have to do the legwork. Will you qualify? I have no idea. I have no idea what your financial status is, and I have no idea, and you can't lie to these guys. They'll have access to your bank accounts. They'll have access to, you'll have to give them I gave them, this is me, a financial statement because I have a background in accounting. I did 16 years in accounting and it doesn't leave. I was doing a spreadsheet for my husband today and I said, oh, I'm just having so much fun. He just said, you're whacked, because I'm trying to I showed him the spreadsheet for the estate stuff. And so I said, you need to start plugging these things in. And so that's what I do. But what you do is you just tell them your expenses that you have, so that you know your rent or your mortgage, car payments if you have them, any other debts. And they might not, they will look at your 401k. They will look at all of that. And you can fight that because they'll say you have enough assets. And prior, a few years back, that's what they were leaning on. And I said, listen, I can't touch that. That is not mine. So we can't touch that. So that is something that you can use in your appeal letter. But more often than not, you have to explain why you need financial aid. If you're just going to see the doctor once a year and your copay is $20, you won't need financial aid. You can wait until an emergency happens and then apply. You can still do financial assistance when you're on Medicaid and Medicare, I think. But I think you should try and see what they say, because you know what? Healthcare is here for everybody. Now, you might not get financial assistance for your medications, which Big Pharma should be just cutting those costs down. Because there was another thing I read about Big Pharma, and I'm like, oh my word. It's horrible. And I think it was today that I read that the vaccine, for those who continue to get the vaccine, that cost is going to go up. A lot of you thought that it was free. No, because if you look at your EOB from your insurance company, they billed your insurance. You just never knew about it. It got charged off. And those who don't have insurance, they didn't have to worry. But they did collect it. And if you guys don't believe me, go back to your EOBs. Go check them out. And that's what they did. They sold it as it's free. It's free. And it's free because your insurance companies were responsible for paying it. So yes, it was free in a sense, but your premiums paid for that. And then others who did not have insurance got it free. Folks, I think you need to be aware. Now, this is my personality. I'm always like, are you serious? And so I start researching things. And seriously, I was going to come on in November about this, and it was the holidays, and I'm like, nah, I don't want to deal with this. Plus, I don't want to bring people down. Although maybe I should, because those who are on this plan, they might start in January or whatever. My husband's birthday is in a few months. So that's his start date until next year. Oh, excuse me. I think I'm tired. I've been really busy. I've been kind of like redoing my kitchen a little bit because I'm like, it's just so cluttered in here. Anyways, I went down a rabbit hole there. I'm back. What I want you to do, though, is be mindful of what you can do for yourself to save in medicine. Now, there's a lot of us that are choosing not to go see the doctors. My husband goes because he's been having some stuff done. He called today. They didn't call back. And so I expect them to call tomorrow or the next day. Yeah. Usually, last year they were really good, but this is the first part of the year. Things could be going on. People could be on vacation, whatever the case may be. It's a good doctor's office. So he'll go in. He's going to take care of what he needs to do. But he'll go in when he needs to go in. So he pays that $20 copay. And then if he gets a prescription, he has that. Testing should be covered. So we're not worried about that kind of stuff. For myself, there are some things I still have to do. I can't do some things that my specialist does. I can't do it. So I need to depend on him. But I am researching all the time. How can I do this without having to go in to have this done? He understands why I'm doing this. And I keep telling him, I keep trying. And I really respect him. He cannot, even if he knew about herbal options, he cannot promote it. Physicians can't do that. I think more physicians are starting to, but usually the administration, they don't allow that, because that means the pharmaceuticals that they promote, where the pharmaceuticals also help support schooling, getting physicians trained. There's a whole dynamic there. It's a big puzzle. But they can't. That is, and you can't be mad at them for not. Now, I do tell them what I'm taking holistically. First thing out of their mouths, even my Lyme doctor used to say, I have no idea what you're using. I can't comment on it because I don't specialize in it. Yet, my Lyme specialist, he knew about a lot of these natural things. So I would just tell him, this is what I'm going to do. When I went off the antibiotics and I started doing things naturally, he says, I can't say anything on this. And he would look through and he goes, these two I know have helped other people. But he says it doesn't help everybody. But that's the same thing with medications. Not all medications will help everybody the same. And that's why somebody might say, hey, I use this, ask your doctor for this. Don't ask your doctor for it. Talk to your doctor and say, my friend uses this and is doing quite well. Is this appropriate for my situation? You got to start talking to your physician as if he deserves to be respected, or she. They do deserve to be respected. They went to school to be a help to you and your health care. They cannot tell you to not go with Medicare Advantage. They're not allowed, I don't think. But I do wish that they could, because they know that if you're on the Medicare Advantage, you might not be able to use their resources in the future. You just don't know. They might recommend a test, or they might recommend a procedure. Yet Medicare Advantage, the plan you're on, will say, no, we're not going to cover it. Not only that, the Medicare Advantage, you think you have pre-authorizations with your own insurance. They have to pre-authorize a ton of stuff. And they might not tell you. So I'm just bringing this up. If you haven't asked these questions with your Medicare Advantage agent, you need to start asking these questions. Know that every year when it's time to sign up for a new one, if you're already on the plan, look for a plan that works for you. And, I just don't know what we're going to do. And I'm like, this is crazy. I don't even like having to say yes to the insurance that we get through my husband's employer, because it's like, it's a lot of money. But we have a good plan. Considering all things, it's still a good plan in terms of, if we don't need to do anything, we're fine. Like last year, I refused to do anything except visit the doctors because we had a certain dollar amount that we could put towards these appointments and for drugs and stuff. I had planned on getting eyeglasses, new eyeglasses, and that didn't happen. So, you know, it's just one thing at a time, and you gotta weigh the pros and cons of stuff of what you're going to use. So last year, I didn't do any specialty things, except when my doctor did ask me about these tests, he goes, I think we should do them. He was trying to get me to do it in December, and he didn't realize that I didn't have the resources in a plan like a flexible spending account or anything like that, or that I hadn't met my deductible. Because if I had done the expense in December and paid it all out of pocket, I start new in January. So think about your costs. If it's so essential because for whatever reason, everybody's health issues are very different. Mine was not urgent in the moment. Mine was able to wait until January. And that's another thing that you can ask your doctors. If they hem and haw and they say, well, I think you should get it now because such and such, just say, I'm going to wait. And if they say, well, you know, this could happen, just say, what's the percentage? What's the chance? And I could tell you horror stories, but I'm not going to, because what I want you to do right now is go through your healthcare plan and make sure you understand what's covered. That is your responsibility as a consumer. And yes, we are consumers of health. But yet when you go in to see your doctor, you are a patient. If you go in and you are respecting them, which I think all of us should, they will respect you and they will work with you. But if you go in there all angry and all upset like everybody was doing when the world fell apart, the world did not fall apart, folks. Things have changed, and it's sad, but you can do your part of having a positive interaction, leaving with a smile on both your faces, and be healthy and working towards a common goal. Sorry, I stuttered there. So that's what I wanted to bring to you. A lot of it's on Medicare Advantage, and then I went down a little, I take side roads. So I hope this was informative. Tell me what your experience is, that you can share, that's not confidential. Keep your personal stuff that is confidential aside. There are some things we all share, but I would be curious as to your experience with Medicare Advantage, because I know that one person I talked to, she says, we find it great. She and her husband, they find it great, which I think is awesome. But it could be where they live. And that's the thing that you need to be asking questions, and know that once you're on it, you might be able to change your plan, but you'll never get back to the original Medicare. Unless things happen and changes are made to get rid of that plan, period, and give people another chance to try Medicare. Folks, I hope you have a lovely day. God bless you.